Hello, my name is Dr. Tara Sky Golden. I'm a naturopathic doctor. I practice in Boulder, Colorado, and I have a specialty in hormone balancing, gut health, nutrition, weight loss. And I'm going to talk today about polycystic ovary syndrome, PCOS for short, as it's known. And polycystic ovarian syndrome is an issue for women, and it's a syndrome. And we don't really know what causes it at the moment, but it is often hereditary in a way, like a epigenetic kind of thing. Like if your mother had polycystic ovary syndrome, chances are you will too. One of the symptoms, the hallmarks of polycystic ovarian syndrome is irregular periods. And there can also be heavy bleeding and flooding with those periods, often because a woman is not properly ovulating. So she's not producing progesterone. She has too much estrogen. So the progesterone is what thins the lining. So she just has too much estrogen, and it creates a thick lining every month or every so often. And often women with PCOS don't cycle regularly. And so there's heavy periods, painful periods. Also, along with that can be cystic acne. There's often elevated testosterone levels. There's often weight gain in the middle, and abdominal weight gain. So if a woman walks in and she's got, I can see that she tends to gain her weight in the middle. She has irregular periods, maybe some acne, trouble getting pregnant, extra hair growth or hair thinning, like male pattern baldness in a woman, and intense blood sugar swings. I'm going to check for polycystic ovary syndrome. And the way I check is I run a full hormone profile. I usually use a Dutch test, and that's going to tell me if there's elevated testosterone, the relative levels of estrogen to progesterone, and then I'm going to treat according to what I see. Polycystic ovary syndrome, PCOS, is often on a spectrum. So I see everything from very masculine women with abdominal weight gain and, extra hair growth on their face. And they might even be pre-diabetic. They might have, endometriosis. They might have heavy periods. All those things are going to point to, one pattern of the PCOS syndrome. I also see very thin women who appear, don't appear to have those issues, but maybe they suffer from acne, or maybe they get, intense migraines. So I'm going to do a hormonal profile. And then when I do that, I see the PCOS indicators. And then when I see the PCOS indicators, I'm going to treat accordingly. So one of the things we need to do is balance out the estrogen and progesterone levels. If they're not ovulating, they need more progesterone. I'm going to make that correction. I'm going to help them detoxify the estrogens that they have that might be causing the heavy bleeding. If they have too much testosterone, I'm going to use herbs and things like that to bring down those levels of testosterone. So, and then, of course, if they're having blood sugar issues and maybe having pre-diabetes or hypoglycemia, I'm going to work to balance the blood sugar, and I'm going to recommend diet and exercise to help with blood sugar. So all those things are ways to work with PCOS. For women with really intense bleeding, I often need to increase their progesterone levels. And so that's all super important. If you'd like to schedule a free 15-minute phone consult with me to see how I might be able to help you, you can do that through my website. And we can discuss ways that we might work together so I can get you back into balance. Polycystic ovary syndrome is a very manageable condition. And there's dangers if you don't manage it. Women who have it are increased risk of developing type 2 diabetes, and also female reproductive cancers from all the extra estrogen. So it's very important that it be managed. And if you'd like to discuss with me further, please schedule a free 15-minute phone consult. Anyway, have a great day. I look forward to talking to you soon.